Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Thank you for joining us for another edition of We Talk Health podcast for West Tennessee Healthcare. Today we have Dr. Kimberly Burch joining us. Dr. Burch is a pediatrician with West Tennessee Medical Group at Hillview South in South Fulton, Tennessee. Dr. Burch, I'd love for you to tell us a little bit about yourself and your practice here in South Fulton, and what types of patients you typically see. So if you could just start by telling us a little bit about yourself, how you came to be a pediatrician, and what types of patients you see.
I'm originally from Clarksville, Tennessee, and my mom was a nurse, and I was always told, you need to go to medical school, and I wanted to be a vet. But there were only 6 vet schools at the time, and I've been very happy that I did choose to go into medicine. I've been so blessed by being in medicine, especially pediatrics, because I get so much more from my patients than I give to them, I feel. I have 2 children who are considered grown, 20 and 22, and out on their own and everything, and so I really delight in my patients now. You know, I pretend they're my grandkids. For 15 minutes at a time. But I did my medical school training at Quillen College of Medicine, East Tennessee, and then did my residency at University of Kentucky in Lexington. And after I finished that residency, I was in Murray, Kentucky for 17 years, and I wanted to do more with my patients and treat them the way I feel they should be treated. And so I was so happy to come to Hillview South and work in the rural health clinic. We have some very, very sweet patients and families. And we see everything there from birth up until we have patients who are in college. Sometimes they have medical problems such as ADHD or depression. And it is so stressful to try to go to a college in another town, find a doctor. And so I'm happy to see those patients and follow up every 3 months with them, make sure their medicines are working, they don't need something tweaked. So I don't kick them out of the nest until they're ready. And as far as the infants, we love to see them as newborns. Because I do still live in Kentucky, over 30 minutes away, I do not have hospital privileges, so I do not follow patients in the hospital. I just need to be upfront about that. I have to only see them in the office, but I do miss that part, especially the nursery part, and we do take care of newborn babies, all the well checks and things like that. If you have private insurance, you can get vaccines at our clinic. We do not have a vaccination program for patients who have the state health insurance, but I've found it to be true that the local health departments do an excellent job at that, and those patients also go for their WIC appointments at the health departments anyhow, so I can't really see making them come for 2 visits. You know, when they're 2 months old, they have to come here for shots and there for WIC appointments. So it just makes sense to keep things like this for now. We also take care of patients with just regular illnesses, ADHD. I make sure patients are properly diagnosed. I don't do the testing in my office. It takes 2.5 hours to do proper testing of a patient with that. I send them to facilities both in Tennessee and Kentucky where they can have intelligence testing, where they can look for learning disabilities, look for other conditions that coexist with ADHD, such as depression, oppositional defiant disorder, other kinds of mood disorders. I follow patients who have asthma. I had an excellent pediatric pulmonologist train me, Dr. Conga in Lexington, and I'm so very thankful to have learned so much from him, and I feel very confident following children who have asthma, allergies. Also, I treat acne. We do see patients who have mood disorders such as depression and anxiety, and I treat those as well. So pretty comprehensive as far as childhood health issues. We can always refer if you need a referral to an orthopedic doctor or, some other specialist, neurologist, neurosurgeon. We see pretty much anything that a child would have.
Very good. So as you can tell, Dr. Burch is basically a hometown girl. She's from this area. She's from Tennessee and sees patients both in Northeast West Tennessee and Southwest Kentucky. So if you are in that area and in need of a pediatrician, you can give West Tennessee Medical Group Hillview South a call. They are located on 1135 Broadway Street in South Fulton, Kentucky. Their phone number is 731-479-2606, and ask for Dr. Burch. She would love to take care of your child. So thank you, Dr. Burch, for being with us. We have other podcasts featuring Dr. Burch on specific topics. If you're interested in learning more about how to care for your infant or child, check those out. And this has been another episode of We Talk Health, the podcast for West Tennessee Healthcare.